ladies and gentlemen. Welcome to this episode of the Greatest Profession Podcast. I'm your host, Matt Asciutto. Today, we're going to be joined by Mike Nystrom, Dr. Michael Nystrom, who is a critical care specialist, works in, just outside of Raleigh, North Carolina, sort of in that general area. And then when he has some time off, he goes and he does some relief stuff, every once in a while. But he, actually has a gig, like a real job, something that I swear I remember having one. It's like a faint memory. Oh, nope, don't have it. Currently, my brain is in that sort of baby fog. We're at week 6 right now, which is hey, sometimes you get a little bit more sleep, but joke's on you, don't rely on it. And once you do, really it's like you expect that, hey, maybe I'll be able to sleep a little bit because he, slept in the crib for like 45 minutes during the day, and then, expectation is just a beautiful setup for disappointment. But we're doing great. So anyway, I'm in that fog. So no, there's no way that I can remember what it's like to have a real job. I just don't have it. Mike Nystrom went to, we talk about this a little bit in the podcast, but he went to the University of Tennessee. He did a specialty internship at the University of Tennessee, and then he did his residency at the University of Tennessee. So that's how I know him. I went to the University of Tennessee. He was a resident when I was sort of finishing up. So, he's one of these guys that he's so generous with his knowledge that really, if you ever have any issue, maybe not you, but if I or people that he knows were to have issues, even in the middle of the night, he's like, just give me a call. No big deal. So I'm not going to pass out his, contact information because I don't want to do that to him. He'd probably answer the phone. He'd probably help you out. And then he'd track me down and be like, what are you doing? Really, the thing that, you'll probably get a little window in here is that he and I are both nerds. If you are not a veterinarian, or if you are not a dweeb and also a veterinarian, there are going to be pieces of this podcast where you're just going to be like, what are they talking about? And why would they do that to me? I will try to put some stuff into the show notes. So if you're a little bit unfamiliar with, carbonic anhydrase and how that, how CO2 plus water equals carbonic acid and how that, works within our respiratory system, that, I just maybe see some of the show notes or do some research, or just like, tune that part out. At the end of the day, we nerd out on that kind of stuff. And when I was asking him, like early in my ER days, I'm like, gosh, I wish I knew a little bit more about how this fluid shifting worked. He like gave me a bunch of resources. He's like, if you're really interested, read these things. Like, oh yeah. So that's us. Anyway, so, I do apologize for some of that, but you know what? We got our little dweeby charm, and also you're welcome. So without further ado, buckle up, ladies and gentlemen, for this episode of the Greatest Profession Podcast. Yeah, I find that I was like throwing the ball for Callie outside, and I it went to my feet, and I'm like, it just like took me longer to get down. I had to like think about how I was gonna. Like, this can't be good.
Give me one of those extended arm things. I can just scoop it up.
Yeah, exactly. There you go.
I don't have to work as hard to throw it. I can just wrist action it.
Yes.
I played 4 games recently. We had our season stacked at the end of the last season. We played 4 games in 12 days. We're used to playing 1 game in every 7 days. So it was a lot. But before that, I could bend down and sit on my heels and pop back up and be fine. Oh, since then, no. And that was 3 weeks ago.
Wow.
My knees are jacked. I had 3 cats in bottom cages the other day, last week. And I went to the first one and did my exam. And I went to go get up and I was like, nope. So I just crawled on my hands and knees to the next cage. And the technicians were just like, what are you doing? I was just like, I got old, guys. I got old real fast. I was like, this hurts too much. Can't do it.
That's awesome that you're still doing stuff though. I mean, I do worry that, with one kid that I'm gonna be like, "Oh, I'm not gonna have time to do anything anymore."
Mm,
But that you're, like, still engaging in some sort of, like, play is pretty awesome.
yeah. Well, I tell people there's been a couple guys that I played soccer with or elsewhere, and they're having their first kid, and they're just like, "What advice do you have?" And I was like, "Bring the kid into your life." I was like, "You have to have a life. Don't
Mm.
turn your life upside down for that kid." And it's a lot easier for the dad than it is for the mom. So you got to be respectful of mom in that regard. But that's you're bringing them into your life. You don't shut down everything that you do and then lose that bit of happiness, that little relief for you. For me, soccer is always it's my relief, and then working on my cars, which is what I was doing right before I got on here, out in the
Oh,
driveway working on the
really?
car. Yeah.
Working
um,
on your cars? I didn't know
yep.
that.
Yeah, man, I got a 2012 car. That's ancient these days. They fall apart like crazy. It's a Chevy Cruze. It's the same thing as a Cavalier, just two generations later. Cavaliers were not great cars. It's like me, man. It hit, what is it, 100,000 miles, and all of a sudden everything's falling apart. Everything.
Wow.
Yeah.
Jeez. I had
So,
a Toyota Tacoma growing up, and the best thing about that car is that nothing ever went wrong.
oh
It was like
man.
manual everything, like the
Hmm.
windows and like, manual shifting and all that. I think it was 212,000 when I traded it in. And the only thing I
Nice.
did was I think I changed the starter once.
That's great.
That's it. Yeah.
Yeah.
I didn't do that. I paid someone to do that because I have no I have no
Oh,
concept as to how to
yeah.
do that stuff myself.
I replaced an engine on a car in college because I blew it up. Sucked up a
Dang.
bunch of water into it, and it bent one of the crankshafts, and then blew a hole in the side of the engine. And I was like, I'm
Holy
broke,
cow.
college kid. I was like, I could change brakes, I could change oil, I could change tires. I was like, why not give this a shot?
That's
What could go
fun.
wrong? I could blow up another engine.
There's like a huge difference in my mind between changing a tire and changing an engine.
Oh, it
Other than the
was a
word
huge
changing.
difference.
Golly.
Yeah, I would do it inevitably. I did it at my mom's house, and we had an auto parts store that was a mile and a half away. And for sure, I would break apart while working on the engine and be like, crap, now I got to go get a new part. And I'd hop on my mom's little beach cruiser
Nice.
going down the road to go get new parts. I was just like, I can't imagine what I look like on this thing. Going to a parts store. I'm sure these guys that I get it from are just like, here comes the guy on the bike again. He's on a woman's
Right, you
bike.
see with no idea what little streamers on the sides all coming from the handles. Got the card in
Yeah.
the spokes.
Yep. Card in the spokes. Yeah, the can on the back tire such that it makes the zoomy sound and
Right.
louder. Yep.
Right.
Uh,
How is that something that you knew how to do or that, like, your mom was okay with you doing?
I knew nothing about it. You can buy these little manuals called Haynes manuals, and it walks
Yeah,
you through most stuff, but you have to have a baseline understanding. So I understood crap. I messed up a bunch of stuff. The check engine light was always on afterwards, so I just ignored it.
right.
As long as it ran and we were good. And it ran, I probably got another 60 miles out of that.
Dang.
And it was eye opening. Gave me the confidence to do whatever else I want to do with a car. For me, it's
Mm,
just, you can YouTube everything today. Thank God for YouTube. Amazing.
right.
And then it's just a matter of just
Yeah.
going for it.
Were you always, like, a kid who, I mean, I guess was like, did you have, like, Tinker Toys and Legos and Connects and all that kinda stuff, or
I can't recall it, but I even look back like what led to me wanting to do this stuff. My dad didn't teach me how to change oil or anything like that I can recall. My
Mm.
I remember doing a little bit of work with my stepdad at some point, but for the most part, it was just a desire to learn.
I always wish that I had sort of, when I think of like the, 90s sitcom dad and son like moments, I never had any of that. So,
Yeah.
so that seems like that. That seems like the dream, man.
Oh man, it is. I didn't have. I wouldn't say I had much of it. My dad was a pilot. And my parents divorced when I was in second grade, so I didn't have a whole lot of it. And my dad
Yeah.
he likes to do woodworking stuff, but not the mechanical stuff that I've enjoyed. I do it now. He was supposed to come over today and help. We have a standing Wednesday appointment now to always come over and do some kind of work and put him to get to work on
Cool.
car work or yard work. Um,
That's
and
really
so he was
cool.
going to come over and do it today. And I was just like, I got some other stuff going on that I was just like, it wasn't going to be useful for him to come over.
Right. So then, like, did you grow up in North Carolina?
Yeah, yeah, I'm a local to Raleigh. I'm a local to Cary. So I was
Wow.
born in Durham and lived in Cary all my life.
So then your family just stayed, and
Yep.
and now
So
you're
my
back?
dad still lives in the house I grew up in. He's been in that
Wow.
house for 35 years, I think, coming up on. My mom owns the house that we moved into when I was in fifth grade. And then my
Neat.
brother's still, he's in North Raleigh, so not far. My sister's, an hour down the road. So we're all pretty close here. And my
That's
stepdad and his
amazing.
family are all here too. So there's a
Wow.
chance to move back home. I jumped all over it.
Yeah. Yeah, because you spent your whole, like, education career, or at least vet education career elsewhere,
Yeah,
right? Like
in Tennessee. Yeah, so 4 years for vet school in Tennessee, one in Massachusetts. So cold, so cold. And then the next four back at Tennessee for the ECC internship and residency.
Oh, okay. So you did do a combined internship residency there, or an internship
Yeah,
into a residency.
correct.
Okay.
Yeah, yeah. I was
That's
the
wild.
guinea pig for them. It went all right, I guess. I think it's a little better now. Now they've got four residents right now and
Oh,
four
wow.
criticalists.
Oh,
Um,
wow.
so a lot different. They're not as fun as
Yeah,
I
for
was
sure.
though. None of them are coming in at during orientation with the nurses going, "Hey, it's gonna be the worst 2 weeks of your life. My goal is to make you cry." I don't know if you had ER and I did that with you. That was always my goal was to come in there and just terrify some people and their eyes get really big.
That's amazing. I
Just
think
joking
at
around,
that
of
point,
course.
by the time I had ER, it was at the point where I was already, like, I had already been broken. Like, I think that because I think I didn't have it until maybe like February or
Hmm.
something like that. Um, yeah, and I was like, man, I was on the ropes sometime in November. I had all, like, the worst. I started out with orthopedic surgery, and I'm like, I have no idea what's going on. I don't know. Anyway, it just, like, got worse and worse and worse. And, like, I swear I almost, like, failed out of vet school in, like, November of my clinical year. So, yeah. So by then, I mean, there's nothing that you could have
Yeah.
done.
You don't face me, Nystrom. I'm not worried about you.
Yeah, I get it. I'm dumb. I'm an idiot. I don't know anything about this. I shouldn't be a doctor. Like, I understand. I've been there.
I mean, but that's
No,
true.
see?
Like, I mean, the only when you get to that point in fourth year, all it is you're you're comfortable with everything. Hopefully, you've already taken the Navly and hopefully passed. And then it's just, you know what? I don't care what you think anymore. I'm going to graduate, but I'm going
Mm,
to absorb as much information as I can. At least, well, the last 2 months, because then they're just like, "Oh, I'm going to be a doctor soon." Is what all the students
r
were like, which is fun to watch
r
how wild they would get. But then you get people, other students that are spicy. One of our friends, Laura Bailey, man, nothing phased her. She just wanted a good fight,
yeah.
no matter who it was.
That's still true.
A good fight, yeah, it is. But those students were fun because then it's just nothing phases them, so they're ready to get in there and get dirty.
Right.
So from
That's
an ER
interesting.
standpoint, it was a lot of fun.
I feel like my experience was different. Like, I was just tired of, like, I knew that I didn't know the things. I wanted to know things, but also I got really upset and depressed that I didn't know them already. Like, it didn't come easy to me. And having no experience beforehand, like, didn't make it any easier.
Oh yeah, tough.
So, yeah, I mean, at that point, it's like I want to know. I found that my biggest frustration in retrospect with, like, ER is that I don't feel like I, like, learned, like, we didn't do rounds. We did, like,
Hmm.
those, like, general rounds where you, like, learn about a topic. We did one over, like, the 2-week rotation. It
Oh
was, like,
yeah,
on
that's
fluids,
rough.
and then that's it. Yeah,
Yeah.
and I don't know. And the rest of it is, I don't know, honestly a blur at this point. But I
Mhm.
do remember distinctly like going into an ER job afterwards being like, I don't feel like I learned anything in my ER rotation that's applicable here.
I took that rotation, but what did I do?
So then how did you choose Tennessee? Because a lot of times when
Um,
I meet people from North Carolina, they like want to go to NC State, right? Like it's right
oh,
there,
yeah,
good school, all that kind of stuff.
yeah, North
So
Carolina wouldn't
why
let me
elsewhere?
in. I was not good
Good.
enough for NC State. I applied 3 it took me 3 years to get into vet school. 3 years. I got
Wow.
waitlisted at Oklahoma State my 2nd year, and then I think actually first 2 years, and then finally got into Oklahoma State and Tennessee my 3rd year. NC
Okay.
State said no consistently. But I'm so glad for it, man. I've heard, I've experienced lots of students coming out of NC State. I've experienced the hospital as a doctor a little bit. It's just, it's not the home that Tennessee was.
Right.
Tennessee was so friendly, so family oriented in a way.
Yeah.
And it was fantastic,
Yeah.
especially with Jenny being down there in the clinic. That kind of spoiled it and made it easier for me. But
Sure.
it's like
Sure.
cheating.
You're right. Yeah, but it's true. And even I've had a friend who, was like trying to get academic gigs at multiple locations and was offered a couple of jobs, and one of them was from Tennessee, and it was like really hard for her to say no because the response was super different. Like a lot of the places were like, "Man, here's a job."
Yeah.
And then like Tennessee was like, "We can't wait for you to come." It's like, there everyone showed up to like the lecture that they have you do
Yeah.
when you're interviewing, and like everyone was super supportive. And it's like, yeah, that's what I remember. I mean, that's what I remember about Tennessee.
Oh yeah. If they paid better, I we'd be in Tennessee right now. But with
Sure.
3 kids and the debt, man, I can't afford that. It's like I don't want
Yeah.
to be cut my pay 70% for going in academia. I love students. I get students right now at the current job, and so I get to teach them and spend time with them. Right now, I got a student from LMU vet school,
Yeah. That's
and so
awesome. Is
that's
that your first LMU like
first LMU.
group or
Yep,
whatever? That's awesome.
it is. He's the class president, so he's a go getter on all regards, and was on top of everything, sending me updated resumes like 3 weeks ahead of time, and we did a Zoom with him two
Yeah.
or 3 months ahead of time. I was like, man, this guy is like over and beyond me and
Wow.
what I'm capable of. And
That's
but yeah,
amazing.
it's been great. I love having students, and the
Yeah.
job set up such to where we've got a relationship now with Arizona for some of their students maybe coming through. We've had Tennessee students, lots of NC State students. I'm trying to think about where else. I think those are the only ones right now.
That's
But
amazing. So, well, because with like Arizona and then LMU, they have that distributive model where you can be like, one of their hospitals and students can
yeah,
rotate through or whatever. So then you've done that with those schools.
yep,
That's awesome. So then it
yeah.
sounds like, yeah, more students will be kind of on the way through the pipeline then.
Oh yeah, for sure.
That's cool.
So this guy's spending
It's
4 weeks with us, which is I'm just like, man, that's a lot of time.
yeah.
That's compared to what I'm used to.
Yeah.
So what am
Yeah,
I
you'll
gonna
be
do with this
ready to
guy?
take over the job by the time that you're done.
Yeah.
That's
I think
fun.
yesterday I was working on paperwork and got caught up in some other admin stuff. I'm just like, hey, why don't you go into that X lap with Brady over there? Go with the surgeon. Hey, why don't you go into this X lap with the ER doctor?
Yeah.
I was like, I need you to do something other than sit here and look at me type up words on a computer. This is getting a little bit awkward. It's
Yeah,
like, okay,
exactly.
see ya.
That's awesome. That's amazing. So then how do you feel like I mean, because you've been in academia for so long, like what with like the internship residency situation, like how I know you're years out of it at this point, but like how do you feel like your approach is different now to like students coming through? Like, are you still trying to make this guy
Yeah.
cry?
No. No, disappointingly not. I wish. I wish. I gotta start thinking about that though. I usually don't have
Right.
enough time with them to make them cry, I feel like, but
But 4
that would
weeks,
be
I
a
mean,
good
4 weeks is
goal.
a lot of time.
It is a lot of
4 weeks,
time.
you can get that deep, deep cut, like, get, like, way inside, and then destroy them.
Yep, that's
So,
very true. I gotta start thinking about that. Um, but I would say for me, I'm a good bit more laid back. I don't have, I'm not sitting here grading them severely or anything like that or harshly. I
right.
like to do rounds with them, but it's one on one, which is a lot different than having a group of students. Which having a group of
Yeah.
students is great because sometimes you'll have one that is more laid back and quiet or more introverted, one that's extroverted. So as a group, it works out really well. If you just have one on one,
Right.
sometimes it can just be like, man, this person's really dumb. Kind of like you probably were in ER.
Right.
Or gosh, I wish they would just let me finish a sentence.
Right.
Um, and it does get to be, it's more monotonous, I feel like, out in practice doing stuff with them. But I just have such short time period with them that it's not terrible. It's really enjoyable. So
Oh,
the other thing
interesting.
that's different about academia versus the private practice is I have to do all the paperwork. Man,
Mm.
in vet school and in residency, the students did all the paperwork. I could see so many patients and not have to worry about a thing. And I remember when I first got out to my first job coming out of residency, I was like, this paperwork stuff sucks. I was like, this is terrible. I was like, that's all I'm doing now. I want to see patients. I don't want to do paperwork.
Yeah.
Um,
Well, as you remember, I mean, speaking on behalf of like every vet student, like, yeah, it does.
yeah, it does. It absolutely does.
So,
Resident life was a piece of cake. I'd
yeah.
read an article, I'd see
Right.
patients, and then I had nothing to do.
I will say that like doing the records for me it's like uniquely suited to my skill set. Like if I could just spend longer, looking up some resources and talking about what I believe the mechanism of these presenting complaints are. I still do this by the way in my records, just not as profound as I did. But it's like I'll write you an 8-page record, just don't make me see another case.
Yeah. Yeah, I'm happy with 4 cases. 4 cases, then I can sit here and write up my 3-page essay on my
Yeah.
assessment.
Yeah,
And people
exactly.
follow me, they're just like, "It's so great because I just know exactly where your head is because it is just like word vomit on paper if I have the time. If
Right.
I don't have the time, it's just like, "Well, we're just gonna continue current care," and that's it.
Yeah. Yeah.
Um,
Yeah, you can definitely tell, like, my overnight notes, you can see how busy it was depending on how thorough they are.
yep.
Like, if it's a
Yeah.
soap, then it's, like, not a lot's happening. If it's
Yep.
like, "This is the update, these are the things that happened at this time," then it's like, "Oh, it was busy."
Yeah.
Yeah.
I'm right there with you. I like the mechanics of all aspects of mechanisms of action and the pathophys of it and trying to lay that down is it's fun.
Yeah.
The challenge, and I've heard you on this podcast is the challenge is my brain. Most of us think on a global scale, looking down on a patient, and so we're thinking, an IV fluid bolus is going to expand their intravascular space and their blood pressure is going to improve. But as a resident, like we're trained on these microscopic little levels. Well, what's that going to do to the endothelial glycocalyx? And then we're
Right.
going to reduce or release endothelin 1 and all this. And so my brain thinks on both levels, but I can't verbalize this to everyone. And so when they ask me, why did I not do this? I'm just like, because I'm just not doing that. That's just, I'm not trained on that and using it that way. That's not useful. They're just like, but
Yeah.
why? And I'm just like, oh, maybe I got to explain this a little bit better so that way they
Right,
understand
sure.
instead of way up here.
Yeah.
And I'm learning that. But that was the tough thing for me, really recently was, why do you do it this way? And I'm just like, I don't know why I do it that way, but I just do.
Mm.
And now I have the ability that the ER team's at a great place, and so now I'm able to kind of take things a little bit deeper once I realize that's why I do it.
Right.
Because to me, it's just a subconscious thing.
That's interesting. Yeah, because one of your like where you are now, it's primarily ER doctors. I mean, I guess
Hmm.
and there's like the surgeons who are there now, but like you came in, right? Like you came in when it was just like ER doctors, and then so your role within a critical list in a place that has been all ER doctors as long as this place has existed, you had to sort of shape that role or like kind of change how the hospital, I don't know, did their medicine in some way, right?
Oh yeah, yeah, for sure. I mean, as a great example, like we used to lose a lot of patients from parvo. from parvovirus in our area. And one of the ER docs did a presentation, dove into research really great. And all of a sudden, things were much better because
Mm,
they were changing the medicine that they did, which was great. But I think they actually monitored also a lot more intensely than what they were doing. And I think that's actually
mm,
what saved the patients. And I came in and I completely like jumbled everything that she had set up. And I was just like, hey, we really need to do this differently. And I didn't see they jumped from, they would check on this patient every 8 hours to now every 2 to 4 hours, and their hydration status assessments are all better. And so they're maintaining fluid.
mm.
And so I came in and I was just like, yeah, you guys are doing a good job, but let's do this. And it really like shook people in the wrong way to do that and kind of jump all over
Right.
things. But the level of medicine that they're doing now is fantastic. I leave the hospital and, you know, I uncommonly get phone calls except for hypernatremia cases really these days, which is my jam.
Cool.
I love that. And they just like, I hate doing
Nice.
the math. I'm just like, yeah, I got this. I got this. Let me call you back in 5 minutes. um, but it's
That's
incredible to
awesome.
watch how they've done. One of the ER doctors, before they went 24/7, and they would just be nights and weekends, and they'd do cut a case and send it back to an RDVM. When they went 24/7 and they had to manage those cases ongoing, she's like, I didn't realize how bad we were at setting these up for success. We
Oh,
had to learn how to hospitalize cases. We had to learn how to do all this stuff with it. And it's something I've certainly taken for granted, always being in specialty medicine. But
yeah.
it's been fun to hear her side of everything and watch them grow in that regard too.
You know what's interesting about that? I mean, to add to that idea is like when you are in overnight hospital, you can just sort of send them out the door in the morning with just a bucket full of optimism as well. you know,
Yeah. Oh, yeah.
you never really have to know how the case did, and so like in your mind, they all went pretty well, which
Oh,
like
yeah.
from a sanity standpoint is nice, right? Like then you don't deal
Hmm.
with the ones that go poorly, but then from a learning standpoint, maybe it's not as good.
Yep. Oh, yeah.
Yeah. I do remember talking to one of probably the same doctor, but talking to someone about that, about like just how much more depressing it was since we started like taking overnight cases. I'm sorry,
Hmm.
like the cases that we were seeing overnight and like seeing them and keeping them through the day. Like it just became so much more overwhelming and burdensome and depressing, like the outcomes.
Yeah. And it's
Yeah.
stressful because it's a different inpatient medicine is a different world than ER medicine is. There's no doubt. I think all of our ER doctors are always, they're just like, how do you do this all the time? And I'm just like, I love my ICU care. I love it. I get stressed out going into an ER, planning on working that ER. Like me, criticalist. Like I go and I'll do a relief shift,
Right.
either for our hospital or someplace else, and I'm doing an ER, and I am going in and I am amped up on adrenaline's going, pumping like crazy, and I'm just like, what is wrong with me? I can do all
Yeah.
this. I was like, I can do this
Right.
so well, like in my sleep, but I'm still so
Yeah.
stressed out about it every
Huh.
single time. But I walk into critical care and I'm just like, yeah, I got this. Not a big deal. Um, I'm not stressed out at all. I'm just worried about meeting new people is all I'm worried about. So it's amazing
Right.
how different that is.
Do you do
So
any GP ever? Like, has anyone roped you into doing
no,
any GP?
nope, not at all. Whew, no. I
Good.
started looking at it just before this job, just as an option to wait out my non-compete at the last job. And I was just like, I don't do surgery. I am terrible, terrible, terrible. Give me a mild wound. I can do that. But still not that great at those, which is very depressing as a criticalist to not be good at them.
Sure.
Um,
Right.
but I was just like, what am I going to tell these people? I'm a criticalist, a specialist that doesn't do surgery. I can't even do a spay. Like
Right.
your patients are better off not getting a spay from me. Take the vet school student over the specialist for a
Yeah.
spay.
Yeah.
I was like, what am I gonna do? But no, GP, no way.
hmm Yeah. That level of anxiety that you're talking about, I experience when I like go into a GP. Like I have to go take my own animals to a GP on Friday, and I'm like already getting amped up about it. Like, I got 48 hours, and I'm like starting to itch, like I'm tingling a little bit.
That is so great. You're like that cat that gets put into a carrier and is just wide-eyed, panting.
Yes.
That's you
Yeah.
driving to the GP for your own pets.
Yeah, this poor veterinarian that I'm gonna see is just gonna be 4 stressed out animals. Because of course, I'm, like, the client that you don't want, who's like, "Well, I got 2 cats who are not gonna be cooperative, and then I got this dog who, like, is a little bit, cautious when it comes around other people
Yeah.
or whatever." And then I'm, like, wide-eyed and like, "I don't wanna be here." Trazodone for everyone.
Yeah.
Like,
Oh,
give them,
man.
like, 300.
Yeah,
I,
including myself. Let me take a shot before I go in.
right.
Do you get gabapentin ahead of time? Like, do you have that to be able to give them?
You bet I will. Yeah.
Yep.
Yeah. When we moved across the country, it was like 4 days, with because each of them, like, 8-hour days or whatever,
Yeah.
with these cats, 2 cats and a dog. And the cats, they don't do well inside the carrier. One of them's fine, like, we'll kinda go in and out, but the other one is, like, he flips out when he's in the carrier. So you have to, like, let him roam free. But when he
Mhm.
roams free, he's, like, standing on the dashboard, and of course, he's, like, a 30-pound, eats too much, and it's our fault, cat. So we, like, gave him a gabapentin, 100 milligram gabapentin, to make him, a little bit more amenable to travel one day, and he wasn't. It was like he was more woozy, which made him more anxious, and so he was more of a pain in the ass. So the next day we gave him, I think, 200 milligrams, and that did the trick, but but I will say that we got to a hotel in the middle of Kansas. There was, like, the closest ER clinic was, uh, Kansas State, which was, I think, at that point, 2 hours away. Um, and he had just, like, developed so much mucus, throughout the day because he's
Oh,
just been so
God.
sedated and not clearing himself. So he sat on the bed, he's like, "Ugh." He, like, started, like, stretching his neck,
Oh,
like, opening up,
God.
like, "Oh, no." And it's me, Lindsay, and our buddy and Ross, 3 ER doctors sitting in this hotel room in Kansas being like, "Oh, no." If this cat dies, like, we have nothing to do. Like, we have no
Yeah.
equipment. We have nothing. So, and then he just went, "Blah," and he, like, spit out this thing and, like, went back to sleep.
It's like, "Oh, thank God." That's
So,
hilarious.
God, I think
I remember when we moved from Massachusetts to Tennessee, I had one of the cats in the car with me. She just kept crying the whole time, crying. I was like, "All right, let me
mhm.
let you out and see what you'll do." And that was a huge mistake. She took a big old crap right in my lap while driving down the highway. Some of it fell in between my legs onto the
Oh,
seat, and driving a manual, and there's like
oh,
no way
no.
for me to shift gears. So
Oh,
I've got myself
no.
pushed up against the back of the seat, my butt's off the seat to be able to try to shift gears and get off the highway. And we stop, and Jenny's just like, "Why are we stopping?" I was like, "Because I've got crap in my pants." I was like, "It is not mine." I was like, "You stupid cat crapped on me while driving."
Right.
The biggest mistake.
And then
I'm
you have to
so
find a way
upset.
to get out of the car while not letting the cat escape out of the car, but
Yep.
there's, like, feces on the seat.
Trying not to smear it because I don't have leather seats, they're just cloth seats. I was like, "This is the worst."
No.
Traveling with cats, not a good idea.
Very difficult. Yeah. Yeah, and we wonder why they don't go to the vet, you know?
Yeah, yeah, I think we set up that problem.
Yeah,
Oh, man.
exactly. God. So is this like, is this in critical care, thing that you're doing now? I mean, is that what you were always thinking about doing?
No. No, so I have a twin brother, always for me, it was vet from the time I was, like, 6 or 8.
Oh, okay.
My mom, in college was working in vet hospitals as a technician, air quotes
Right.
there, and, so she had some influence. We used to always bring home, like, lizards, and, of course, they'd die in the laundry because they'd just be in our pockets, or we put them in a terrarium and they'd die a few weeks later, so just these little terror boys. But always wanted to be a vet, and so in college, he started working at an exotics practice in Raleigh. So he wanted to do exotics, and I was like, that's cool. I have no desire for that. No desire to get bit by birds. And so I wanted to do GP. So I started working at the specialty hospital in Cary, VSH, and I worked there for 2 years in the surgery department. So I came into vet school. I was like, I want to be a surgeon. I was like, this is so exciting. Loved it. I loved scrubbing in and helping. Then had surgery lab, and I was like, this is terrible. No more, no surgery.
Yeah.
But I was like, I want to do something exciting. I still want to specialize. And I was like, maybe I just want to do ER. And you know how you just sit in a classroom all day long, nonstop, and you're just bored. And I was like, no, I'm really hoping that this is just a boredom thing. But then I did anesthesia one summer, and I remember this case. I was on call. It was like 2:00 in the morning, and it was a dog with a diaphragmatic hernia. It had been neutered 2 days prior, and it was a stray before that. And so they knew nothing about the history of this adult dog. So it was probably a chronic diaphragmatic hernia. And we put it under anesthesia, and it was bucking the ventilator. So we gave it cisatracurium, and it arrested. And we did CPR on it at 3:00 in the morning. Of course, we didn't get it back. The surgeon had already started unzipping the abdomen, so he just went straight into the chest and started doing cardiac compressions manually, which was just wicked cool. And then afterwards, I held up the anesthesia resident for 45 minutes in the middle of the night, asking him why we did everything. And they were just like, they couldn't explain it. Of course, their mind is just like butter. And most students, when they had an animal arrest on them, they walk around like a mummy the rest of the day, or a zombie. They just have this glazed look on their face. And here I am at 3:00 in the morning, super stoked, so excited about it. And I was like, all right, maybe ER is a calling then. But I didn't know what critical care was, because we didn't have critical care at Tennessee. My 4th year, we hardly had ER for the first third of the year. And then I learned what critical care was at Tufts, and I was like, this is awesome. I love it. And got my ECC internship, because I thought originally, I was like, oh, I want to do daytime ER, because I'd already had a kid. I was like, I want to do daytime ER. So that means, in my mind, I have to be a specialist. That's how I looked at it. I didn't think that ER doctors worked during the daytime. Lo and behold, I was wrong.
Right.
Yeah, very wrong. But so I wanted to specialize. And then during my internship, I learned what critical care was. During my ECC internship and residency, I fell in love with it.
What about it did you fall in love with?
I think it's just something to be able to follow a case and stay with a case and learn the in-depth aspects of it. Is probably the big thing. You know, similar to you, the mechanism of action, all the ins and outs of a case, evaluating, you know, let's take a simple urethral obstruction cat. To me, they're not just a simple case. Like, I look at how much volume have we put in over 12 hours, over 6 hours, over the past 24, compared to how much it's produced. Where's our weight gone? You know, what does the patient look like? What's going on? Am I actually treating the obstruction and the primary cause? Is it just due to urethral spasm, or are we just due to, you know, a plug and some other stupid stuff? And so for those cases, like, I got fascinated by, you know, that minutia of everything. And then you put an animal up on a ventilator and on the tree of life. They're on, let's see, I think the most I had was 12 different infusions at one time. And you're managing all those different aspects of them. You got them on a propofol CRI, midazolam CRI, fentanyl CRI, norepinephrine. You've got the ventilator and all the settings there. You've got them on LRS, and then you've got them on, you know, different aspects of KCL or KFOS. And it was just so much fun. Gosh, I used to, again, back to torturing students, DKAs would come in, and we'd start talking about KCL and KFOS, and we would run them on just individual syringe pumps at Tennessee from time to time. And I'd talk with them. I'd get them to calculate out what potassium supplementation and how much we wanted from KCL versus KFOS. And then I'd be like, all right, what happens if the phosphorus does this? And their heads just start spinning with all the math. And I'm just like, this is so much fun, guys. How are you not excited? And they're just like, oh. That's when you get them crying really good. But that's where
you get those good quality tears, the ones you collect in a jar.
Yeah. These are the ones that I live off of when I'm completely dead in the middle of the night. I got to take a little slurp of some student tears.
Yeah.
But it's just that stuff is just, I mean, that's where I live, and it was just
Yeah.
so much fun, all those ins and outs.
I mean, all of that stuff seems to exist on the same line. Like when you're talking about, the case in the middle of the night where you had to do like the CPR, like why did all this happen? Like that's the same thought process, right? It's
Yeah,
like, yeah. And I could probably also draw the same line to, the little bits of how putting something together in a car, right? Or like, what does this hose do? Like,
yeah, yeah. What does this go to? Oh yeah.
right, exactly. There is some bit of it. It's not about like, looking at the car in the driveway. It's about like getting down under the hood and like, and screwing some nuts or whatever. I don't know what goes on under a hood.
Those are there. Those are there. You're good. You're good.
I assume so. That's really interesting. So then what was it about being a veterinarian? I mean, what appealed to you if you can remember, like at 6 or 8? What was it? Because those are obviously very different images of what a veterinarian is.
Oh, for sure. I don't know what it was, honestly. We always grew up with pets, not anything spectacular, like one or two cats, maybe a dog. And it wasn't like whenever they got sick, I was super excited about what's going on with them.
Mm.
I usually had no idea, and I was a little punk kid. I would take firecrackers around July 4th and throw them at animals. I was I was not a good person to animals.
God.
Throw them at
Yeah.
wildlife animals, not at owned animals. But I don't
Very
know what
different.
actually drew it to me. Yeah, wouldn't
Less
be too
evil
happy.
if
Yeah,
it doesn't have
maybe.
Right.
But no, there's just always a draw to it.
Hmm.
um, Humans are gross. There's no doubt about that.
Right.
All humans are gross. When something happens with a human at our hospital, I've made everyone aware. I was like, if you faint, I'm running the other direction. I was like, I know exactly what to do if you were a pet, but I am not going to be present for this human stuff. They come and get me because I'm a criticalist, and
Right.
so I know things, and I'm
Right.
like freaking. I have this calm face, and I am freaking out inside. I am just terrified, and I'm looking for a way out,
Yeah.
looking for someone else to step up, and
Right.
but that stuff is just, it's calming. When we do CPR now, um, I'm in heaven. I'm sitting here joking around with the staff so that way they can relax a little bit
Mm-hmm.
and still running the show. And we're all having. It's terrible to talk about CPR and having a good time,
Right.
but it's important to also be able to take a breath and relax. That way you can actually
Yeah.
see what's going on.
There's something, I'm going to paraphrase something that John Cleese said actually, where it's like we confuse seriousness with solemnness, where it's
Hmm.
like, if you're just because you're not solemn about a situation doesn't necessarily mean that you're not serious about it. So I feel like that happens pretty commonly, and it's like in the ER and CPR especially. I was just talking about this after we did one of those little I don't know, moratoriums or post games or whatever, like after you do the CPR, we were
Yeah.
talking about it. And it's like there was a little bit of joking and someone brought it up. And it's like exactly that. It's like we don't have like we were doing our jobs. Everyone was doing their thing. And we were like focused, but also like having some, lightheartedness to it. Otherwise we would all, I don't know, crawl into a hole afterwards. I don't
Oh,
know.
absolutely. Yeah, and that was one big thing that I brought to CPR at during my residency. Because students, man, it just wore on them harder than anyone. They've got their hearts and souls put into these patients.
Right.
As the doctors, we've already separated ourselves and put up a little bit of a barrier. But students are attached to owners, they're attached to the pet. They see the outcome of that pet on their shoulders, and then they have to do CPR on them, and it's that is like soul crushing in a way. And we all have to experience it. It's good for all of us. Reality check in a way, but like being able to bring a little bit of humor and relaxation to a situation like that, especially with students, was so big. And I still find it still the same with some of our nursing staff. If you can bring them to the point where, you know what, this is very stressful, and they're panting and they're really worked up and they're all flushed and red in the face. If you can just bring them down a notch or two, then they're paying attention to what they're doing, which is the best for the
Right.
patient. they're
Yeah.
having some degree of learning capability for it. And at the end of it, they can sit here and take a deep breath and be like, that really sucked. But gosh, I'm glad that we did this. Now we're better for next time.
Yeah.
Each opportunity is each CPR is a learning opportunity to me, a teaching opportunity. And the only way I'm going
Hmm.
to do that is if, I got the trust of the staff to be able to do that. And if they come out wanting to learn it and not and do something better next time as opposed to being terrified of it the next time. So,
Yeah. Yeah. I think you're right about the nurses too. I do think that like it's probably a very similar thing, right? Like they're closer to the patient. They're, giving more nursing updates. They're actually there playing with this animal, whereas like you and I are writing notes about how someone else is playing with the animal or whatever.
yeah.
So yeah,
Uh,
it's really rough. I mean, especially when it's an animal that's been in hospital that arrests. I mean, it's gonna
yep.
be really rough on the team.
Yeah, and I'm in it well enough that I can walk in and it's like you can smell it in the air and you're just like something's going to arrest today. And you set yourself up and you put up that barrier like I really want this dog to do well, but I'm expecting it to die
Yeah.
because of where it's at now. And I always tell people just like trust your gut. I trust my gut all the time. Most of the time it's right. The other day I was wrong and I said this animal's going to die before the end of the day and it survived and did great. And I sent it home 2 days later.
Right.
Um, but like I have that ability, and many people do. I'm sure you do to some degree as well, to put up that barrier. But some of the staff is just so hard because their blood, sweat, and tears are in those patients.
Yeah.
Um, which just drains on them
Yeah.
even harder.
Yeah. Yeah. And with students, it's hard. I remember these types of man, these cases where you lose them at the end. You're absolutely right. I mean, not even just like your blood, sweat, and tears in like those moments. It's like you're exhausted from the entire clinical experience.
Yep.
You feel a certain way about yourself. It's like you're definitely not good enough. And then something like this happens, which just like confirms everything that you feel.
Yeah. yeah.
Yeah. Did you, like, ever feel that switch happening? Because I mean, as you kinda move up and become more and more specialized, and you do gain that little bit of separation, right? And I remember in my first year out, there were days where I had to euthanize, like, 12. There was one night in
Oh
particular I had to
God.
euthanize 12 animals, and I just,
Man.
like
Wow.
I needed a minute. Like, it definitely messed me up. Um but then, like, I don't know. I can't really identify for me, like, when that switch occurred, but I was just wondering, like, if
Hmm.
you have any insight into that for yourself.
I think it varied a little bit. I think coming into my internship, I was a little bit sensitive, and then I remember being less sensitive like part of the way through, and then my wife and I euthanized her dog that she'd had before her and I were together. And then it was like every
Mm,
euthanasia after that, I'm like sobbing. And especially if there was a dad with kids in the room, oh
right.
man, I was toast. Um,
Yeah.
and then I think I started my ECC internship and I euthanized the first day of my ECC internship. I euthanized 2 out of 5 patients, or they were dead at the end of the day. And I was like,
Mm,
well, I guess that's what I get for ECC internship. Then started
right.
my residency, and residency was like 3 out of 4 were dead at the end of the day. And I was like, man,
God.
this isn't going well. And then my
Jeez.
first job as a criticalist, I walk in the hospital a little bit early just because I hadn't really been there and I didn't really know anyone. And one of the ER doctors was like, oh, I'm so glad you're here. I've got this case. I have no idea what's going on with it. It just acutely like changed overnight. It was admitted yesterday. And like I'm looking at it, I'm just like, man, this dog has a thrombus to its back legs. And they're just like,
Mm,
how do you know that? I was just like, it's voodoo Jedi magic. Don't you know that? That's what we do as criticalists.
right.
And sure enough, it did. There was another dog with a chest tube that had a spontaneous pneumo that we put under anesthesia and it arrested in the
Yeah.
CT scanner. And so we got that back. And then I managed it for 3 hours trying to get its blood pressure up. So by the end of that day, out of 5 patients, I had 3 that were dead.
Jeez.
And so I think it was just like a beat down every single time I start a new aspect of the critical care career that I was just like, gosh, I'm in for this. This is going to be terrible.
Man.
Um, so I don't know where it really went along those ways. I actually remember even before vet school, we would have, because my wife worked in surgery, or she was an anesthetist, and she would get upset because a patient that she took care of, let's say a hemoabdomen splenectomy, she took care of it under anesthesia and it would die while it was still in the hospital, and she would get really upset. And I was like, I don't understand. I was like, you had this for like an hour and a half. Why do you care about it?
Oh, right.
Um, and then I remember my first patient dying as a student and being like, Jenny, I was like, I know what you're talking about now. I know why you feel so upset. Um, but
Yeah.
somewhere along the way, I guess I put up enough barriers such that I can do all right. Manage those 3 or 4, the 12. I'd probably be in the same place as you. God, this really sucks. Like
Right. Right.
automatic depression for the next few days. Got to pull myself out of this.
Yeah.
Um,
Do
but so
you,
I don't know.
one thing that so when I think about like how I'm approaching the job now, I wouldn't necessarily say it's like lack of empathy. Like I don't think it's that far, but there's
Mhm.
definitely a lot of separation, right? Like I need to be able to do that in order for me to like do my job, right?
Yeah.
Um, but then I also feel like it bleeds into other aspects of my life. Like I just feel like in general, maybe my empathy is decreased as compared to what it was before, like an open little flower child. It's like, I love the trees, like look at this cricket, and you know. But I do have this sort of very maybe immediate fear as with a a kid on the way, right? Like we're expecting
Yeah.
a son, and I know that like a big part of what happens in the first year is it's really difficult for the father to connect to the son, blah blah blah. Anyway, I just have this general fear that like maybe I'm not going to be able to like be empathetic and involved in my own relationships in life, including like with my own child. um as somebody who has kids, like what are your thoughts on that? Like,
Oh, for sure. For sure. I have the benefit right now that my car ride to work and my car ride home is an hour with
right.
very minimal traffic, so I don't add more stress to my day, and so it can allow me to. It's kind of cathartic in a way. I
Mm.
listen to silly podcasts like The Greatest Profession. Um, for some reason, it's always a veterinary podcast that I listen to, which is also silly. I was like, why do I want to put myself back in this more?
Right. Right.
But that helps a whole lot. And then it is stressful, and it's really whenever I'm out of energy that it's hard to do, and it's hard to separate that stuff.
Mm.
But the kids, like if I just actually take a deep breath and look at the kids, I mean they're inspirational to me in their own. Each one of them has a different personality, a different approach. One of my daughters is more involved. She's got anxiety and ADHD, and it's really tough to keep her on track. And then she gets all worked up. But if I actually take a breath and look at what I've got and what I've got around me,
Mm.
it's you got to be able to separate yourself, I think, from the job. And I think you'll realize that, and I think it's to some degree you and Lindsay already have by saying this is what we need to do moving forward, and you've already developed a little bit of separation from your work and your life, and that's
Right.
that's the key right now. I'm supposed to be getting out of work. I'm done around 4:30 or so. It was fairly common for me to be there till 6 o'clock, and now I'm just like, you know what? I'm out the door as close to 4:30 to 5 o'clock as I can be. If I've got paperwork, I'm going to finish it from home after the kids are in bed, because that little bit of time that I have is
Mm.
important to me. I get to see him for 5 minutes in the morning, and I get to see him for maybe an hour or two in the evening. Um, but they can really unload stress from me, unload that um, that lack of empathy, and kind of be a recharge for the empathy aspect. They can also make it hella worse, for sure, for sure. And then I got to find something else. Like I was like, Jenny, I have to go tinker with the jet ski. I was like, I need
Right.
moments. I need moments.
Right.
Um,
Yeah.
but I think that's part of it. Is you've got to have something outside of work, and for you, hopefully, it'll be Lindsay and the kid, and that'll help. But you're also going to need something outside of that, because
Right.
inevitably they are stressors as well. And so you need, I think for you, you talk about a lot about playing instruments and this podcast, and it's a different world for you to
Hmm.
have that relief. And I think that's so key to some people. It's working out. For me, some soccer, tinkering with vehicles, or doing lawn work. which lawn work, I'm just like stressed out about having to get it done. But while I'm in it, it's just, yeah, this is my zone. I'm really pleased with this.
Yeah.
So
That's
I think that's
interesting.
the big thing.
Yeah, so like tapping into the other bits of life where it might actually feed your humanity, that might restore some. That might like recharge some sort of battery that might be depleted otherwise,
Yeah,
it
perfectly put,
seems.
I'd say.
Okay, so I don't have to be worried that I'll be like, some sociopath or
I mean, it's still possible. It's still possible.
it's
I
still
can't I
possible.
can't determine that one. We'll touch base every now and then and make sure that it's going all right.
Right.
I'll reach out to Lindsay.
Right. Yeah, that's
Just
probably better.
keeping tabs here.
Yeah. 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 I am. I mean, that's been truly people always ask like why do I work so far away from home? And it's like that to me is the separation. It's wonderful to just get on a plane and like leave the shifts like way behind.
Yeah.
Like
Yeah,
miles. I want to
100%.
put the Great Plains between me and
Yeah.
work. Yeah.
Oh,
But that was
absolutely.
necessary for me. I
Mhm.
find that like there's certain parts of this country because I traveled so much where, and those parts are just associated with work and work alone. That when I drive down, so like there's the drive between Raleigh and Emerald Isle. The only times I've
Mhm.
ever made that drive was coming back or going to, from work, right? So it's just like every time I pass this specific barn or these fields or this solar farm or whatever, I just like there's a
Yep.
lot of stress that happens.
Oh, yep, it's a little trigger for you.
Yeah, exactly. And that could be why I hate the Denver airport. I mean, it does suck. It's a terrible airport. but, but it could be
Yeah.
that that's mostly my association.
That is very interesting, and, I never would have thought about that as, reasons for one thing or another, and anxieties induced by simple things going along the way, for sure.
Oh, yeah. It's amazing. I can see it in Lindsay when we go back to North Carolina. There's like certain spots where it's just like both of us probably get a little bit amped up, like her more so. Um, yeah, just honestly being in Raleigh, truly, I just think the memories that we have from that area, just life was so stressful at that time. It's like there's nothing wrong with Raleigh. It's just like the way we were at that time, it's really hard to disassociate. So
Yeah, for sure.
I was gonna ask like how do you feel like because it's all a balance, right? Like between life and work and all of that, but like added on you have all of you have like kids and then you presumably like and you have like this long commute and then you're working quite a distance away and then doing this thing that otherwise is like all consuming or whatever. My question is like how do you maintain a relationship with your wife? you
Oh,
know
it's hard. It's hard. For us, it was getting the kids in bed at an earlier time.
Mm,
So let's see, the girls are in fifth and fourth grade right now. Jackson's in kindergarten. So when the girls were younger, it was bedtime at 7 o'clock. We put them down. They're done. We walk away at 7 o'clock, and then we're good to go. We have until 9, 10 o'clock to have our own time. We have lunches for the kids or finish cleaning up from dinner, and then we have our time.
mm,
The challenge is actually using that time and making it beneficial for us as a couple. Um,
right.
we've never been big about working out, and so we're working out with each other because her and I are so different with regards to our, I don't know if athleticism or is the right term, but so for what she needs for workout is different than what I would
Hmm.
enjoy.
Right.
But lately we've been getting up early in the morning because I have to get up earlier than she does, but she'll get up with me and we'll do a workout that she wants to do. And that's
Mm,
something else. And you're not necessarily spending time bonding with that individual, but that's time that you're committing to them to do something with them.
right.
And then on top of that is, you know, we have resources here to be able to help us. So my father is practically retired. And so I can just call him up and be like, hey, can you come watch the kids? That way we can go on a date. He's just like, yeah,
Right.
sure.
Nice.
So trying to make time for that. But it's tough. It's another commitment that you have to actually practice and put energy into. And
Yeah.
sometimes we suck at it. Sometimes we suck for sure.
Yeah.
Um, but it's something just like anything else. I've got certain yard work that I've got to get done every week. Well, I've also got a wife that I've got to spend time with every week, and I've got kids' practices that I've got to go to, and so it's just a matter of carving out that time and making
Yeah.
it useful time as well.
Yeah. I f- I definitely hear both of those things. I mean, sometimes just putting something on the calendar is like all that's required because it's just so easy. I mean, for me, I found out that like we can be like, oh yeah, we'll do something on Saturday, and if it's vague
Yeah.
like that, then you're never going to do it. And
Oh yeah.
whatever it is not going to be something that is actually truly ultimately beneficial for the relationship.
Hmm.
Whereas if it's like no 7 p.m. We're gonna go and throw pots or whatever. It's
Yeah.
like then at least it's something and it's on the it's like you've made time for it just like you made time for anything else.
Yeah, and I
Yeah.
think it's even better. So, and you'll understand this whenever you have to arrange a babysitter. It's even better when you have to put someone else out of their way to do something. So, cover the kid,
Right.
because then you're forced. You're stuck. We're not getting
For
out of
sure.
this kind of thing.
Yeah, these are all things that I mean ultimately yeah, it's about making the time for anything, right? And to your point, like if you have your Wednesdays where not only are you fixing up cars or whatever, but you're also spending time with your dad. And like I mean, that's a legitimate thing, and it's like the standing appointment on Wednesdays, which is an
Yeah.
amazing thing. Like you've made the time for it, and even just holding space for one another, like being in the same space. Like yeah, while working out may not be asking each other what each other's fears are, like
Yeah.
what are your dreams? What do you wish was different? I mean, sure, but also you are in the same space. You're doing this thing together. I do think that that's like a form of you're spending time. That's bonding. I think that counts.
Yeah,
Yeah.
for sure.
Yeah, one of the things I need to be better about is making time to actually practice guitar, like to sit down again and do just like here for this
Oh,
hour, like do these things, feel connected with it. Because that's been the thing that has gone away. That's the thing that's the hardest to keep up with when you're on the road all the time, right? You either bring it with you or
yeah.
it's gone.
Which bringing it with you would just be a
Yeah.
frustration at times. I imagine it's not as easy to pack up as a pair of gym shorts, for sure.
It is. Yeah, you're absolutely right. I bought a 3/4 just so you can usually put that in like the first class closet. They always say, "Oh, I don't know," but they like always get it in there.
Yeah.
So
Yeah. Always.
right. but anyway, yeah, I mean like but then that's your carry-on, right? And for
Hmm.
someone like me who's traveling all the time, like that is its economy of bags. Like I
Yeah.
want to fit all my like scrubs and whatever into or workout clothes or whatever into the thing. I don't want to have like this other appendage and then I feel guilty because I brought it all the way and I'm not really playing it because I'm exhausted after the shifts. So,
Oh, yeah.
but
It's so hard.
anyway, what are you is there anything that like during all this time because you've you know gone around and a lot of that has been like vet school residency or vet school internship plus and then residency, like are there pieces of you that you felt kind of like went away that you've had to reclaim in the meantime?
Um, I think the big one is, one that we already hit on was not being around
Mm,
at home. As a resident, and this is something that both my wife and I struggled with was, at more or less the residency came first. I actually remember interviewing for the residency during my ECC internship, and someone asked me, what I would do if I didn't get a residency. And I told them I had already had two of the kids by that point. And I was like, I'm going to go out and practice and be bored and be a great dad. And they're just like, well, we don't really think that's good enough for us if that's all that you need. And I'm just like, this is my life. I was like, I get to live it how I want to. And their eyes went really big. And they were just like, what? Did he really just say this to us? And I was just
Yeah.
like, you know what? It is what it is. My work is only part of who I am.
Mm,
And being able to come back. So it took me a while out of residency to be able to come back into the actually realm of being present. Um, but coming back was, the greatest thing. I'm more
Mm.
active. We have a garden now that I take part in. My wife grows veggies. I'm the one that maintains it. I've got 2 other gardens that I've set up in corners that weren't growing grass. I tend to my yard. I go out and pick weeds by hand, which is terrible, but the OCD just can't deal with it.
Right, right.
Um, the house is a wreck, but the yard looks good.
That's so funny. Yeah.
Yeah, but being present and living the life here is has been so clutch and so big on that part of the voyage. Being able to come back to it, and a lot of it's been led by my wife saying, "Hey, I need you to be here." I was like, "I've lived without you for 5 years during your training. Now it's time to
Mm.
get your crap in gear. Come be a part of this."
Yeah.
Um, but it's been great. It's a whole new world out there every time, every year for me. Looking at things differently and seeing how the kids are growing up. What's new this season? What are we going to do in the off season? How are we going to take advantage of time? When are we going to start to travel a little bit? And where are we going to go? Kind of thing. So it's
Yeah.
a lot of that is just bringing it back home and
Yeah.
living life. I didn't. So my wife and I met and we moved to vet school together, and we met 2 years before, and so we didn't have that time of being young, having money, or being able to travel because I went straight into vet school. And then we had kids during vet school. So we've been poor, arguably still are. So we didn't have that travel time. And now we're getting to a
Right.
point where we can still be poor, but now we can take advantage and try to do that traveling.
Mm.
Ditch the kids and the grandparents for 3 or 4 days, kind of thing, and go off and enjoy ourselves, which is so much better
Yeah.
than traveling with kids. It's terrible. It's like that guitar that you want to put in the little storage area, and they tell you no. Oh, the cat
No.
that poops on you is what
Right.
it really is.
Right. Yeah. Yeah. Did Jenny know, by the way, like when you guys first started all of this, like when you were gonna go to vet school, I mean, like she signed up for a long time of waiting
Oh
for like
man.
life to be normal again. But it seems like it came in stages. Like it was like, all right, well, I can commit to this 4 years, then it was like another year, and then it was like another four.
Yeah. I
It
don't
had to be
I don't
rough on
think
her.
either one of us really thought it fully through in that regard. She being that so she when she got licensed as a technician, she moved out of West Virginia to a Virginia Tech and worked there as a technician in the ICU and doing some research, and then moved to private practice in Raleigh. Um, she was adamant that all students should do an internship coming out of vet school. There are few students that are legitimately ready to go into practice and do a good job. And I wanted to specialize, so that was no problem with me. I was sure not ready to practice. I was not one of those students. I did really well. I made good grades, but hell, man, I would have been terrible. I was terrible
Mm.
as a clinician the first 6 months out during my internship.
Yeah.
So she already knew, and she's the planner. I just kind of fly by the seat of my pants most of the time. She already knew she was in for at least an internship, and she knew I wanted to specialize. So that was what it was. I don't think that either one of us expected the kind of commitment that was involved going into it. I remember
Mm.
Dean Brace, good old James Brace,
Right. Yeah.
orientation. He's just like, you're expected to study 1 hour for every hour you're in class.
Right.
And he had a meeting with the parents, and Jenny was part of that meeting too, and listened to it. And I'm just like, God, that sounds terrible. But man, for the first, I don't know, 3 months of vet school, I was studying 3 or 4 hours a night. My first
Mm.
exam, I went out the night before because I was already done studying. I studied enough, and I went out for drinks with Jenny and one of my classmates. We were ready to go the next day, kind of thing. That did not happen all through vet school. I got much worse at it, much more reverting to college days of staying
Right.
up late. Um, but so she was always used to that, and she hung on and was patient. But man, I don't know how she did it. Sometimes I look back and she was committed for it, which was great, and I'm grateful
Yeah.
for.
Yeah. So like when you were like, "Oh, I'm gonna go back to residency and do that," was it like a disappointment thing, or was it like a, "All right, we'll figure it out," or "Hey, go for it"? And
um, she knew I would be terribly bored and not having a enjoyable life as a general practitioner. So her
Mm,
commitment to me was, I want you to do this because I want you to be happy. Um,
yeah.
and for me, it was, I knew nothing other than the job. You know, for vet school, you're nearly completely committed to that learning aspect. And I've heard you say on the podcast, like, it's a career. You're in vet school, it is part of your career. And I looked at it as that. I had
Mm,
been out for 2, 3 years trying to get into vet school, so I understood what it meant to be in vet school. And I watched some of my classmates go out 2 or 3 nights a week, and I'm just like, you're not in college anymore. This is actually what you want to know. I was like, I
right.
took a camelid course, and I was excited to learn about that stuff. I could give two craps about camelids, but when I was in
Right.
it, I was in it, and learning
Mm,
those things, and because it was part of my career, and I viewed it as that.
right.
And then you get out and you graduate, and then you're actually working your career, and then you got to figure out how to separate that and come back to the living, and not just
Yeah.
be a career and that's it. And there's some people that, if you don't have that drive for outside stuff, and you don't have someone at home, or you don't have a great hobby that pulls you away, you're committed to the hospital. You're committed to that work and research. And those people, I admire them, and they do a great job. And but to me, the part of living is the part outside of work. I work to be able to
Right.
live, but I don't live to work.
Right. Yeah. And it's like, and you're right. I mean, if not for those people, I mean, those are the people by and large who are like making big strides and big discoveries. And, we have a lot of them to thank for a lot of the medicine that we get to do. So
Mhm.
it's like, it's hard to be like, hey, like leave at 5 because that's the end of the day or whatever. And so-
Yeah.
yeah. And similarly, I mean, I would say with people who are starting the hospital systems or trying to figure out ways for like co-op funding for veterinarians to buy practices or whatever. I mean, like all these people who are they're doing a lot of work so that the rest of us can do that, right? That we can live whatever our life is. So
Mhm.
I'm thankful to them, but also no thank you.
Yeah, no, no,
Like,
no, thank you. I mean, think back to the times when you got out and you were more comfortable in ER, and you're busting, you know, 15, 20 plus hours or 20 shifts in a month.
right,
I mean,
right.
you're doing that, and,
Yeah.
not a big deal, and you're enjoying it to some degree. You're probably a little drained. But you could do that. Now you're working 12, 14 shifts in a month, and you're just like, how do I do this? Um,
Right.
and your knees are all busted, and you can't even throw a ball with your dog.
Right, exactly. Yeah, yeah,
But
yeah,
it changes. And I think, one thing that changed with you was your relationship with Lindsay. For sure changed that. And, upcoming being a dad, 100%. And you guys are recognizing that, which is so fantastic.
yeah,
Um, because that is your commitment to a life outside of vet med, which is so
yeah,
important for longevity within it. Um,
yeah. And it's hard to find the balance because it's easy. What I found is that it's easy then to just walk away and like not care whether or not you're practicing current medicine, right? Like it's pretty easy, especially not being super far out, where you're just like, yeah, this is good enough.
mhm,
And I found myself, like I wasn't reading articles. It's like I'll go to I'll go to a bunch of conferences, but it's like, do I really review those notes? Um, but then you feel like you're missing something too, because a huge part of you up to this point was that person who was the lifelong learner, who was
mhm.
curious about all of these things. So yeah, it's like finding that middle spot where it's like it's not entirely work stuff, but also like, you do have to learn these things. You have to keep up with it. You have to engage in curiosity about your job too.
Yeah.
That's a balance I guess I'm trying to figure out right now.
Oh, so hard. I imagine you'll never find that balance that you're hoping for, because it's going to be so tough. You
Sure.
hope for the time that you can do it all on the job, and you can read up on stuff on the job and not have to bring any of it home. But inevitably,
Right.
that's never the case. How much time do we have these days? Very little, because all hospitals, no matter where you're working, are busy.
You know what I take comfort in this. It's a this hackneyed notion of like a balance is not a steady state. Like there's, if you're on a balance beam or whatever, it's like you got arms to the side, you're going like back and forth and back and forth. Like when I was a chemistry student, I I really took comfort in the equilibrium. Like the fact that equilibrium does not mean that everything is just sitting on both sides of like products or reactants. It's like they're going back and forth constantly,
Mm,
but it's like this is the state where it's like there is this number or there are this number of products and then this number of reactants, but it's we're all moving at all times. So it's like I
yeah.
take comfort in that because I'm like, yeah, I'm not necessarily where I want to be. Like, but then that doesn't mean that I'm like in constant flux, right? I'm always
Hmm.
learning still. I'm always trying to figure it out. It's as long as I'm aware of it and keeping a spotlight on it, then that's what's going to inspire me to pick up the guitar. It's going to inspire me to pick up the articles or whatever.
Yeah, for sure.
So I'm okay.
Shift towards one and away from another at time to time. It's really
Yeah.
funny. This is the terrible where my brain's at. As you're saying this, I'm like going, oh, CO2, carbonic anhydrase, and bicarb,
Yeah.
and how they're all balancing.
Right.
Like that's how my
Yeah.
brain's thinking about what you're saying
Yeah.
this, and I'm just like, why? Oh God, I got to get away from all this medicine stuff. That's all I'm thinking about right now. I'm shifting the
Right.
wrong direction. Go back to
That's
something.
right, but then, like, that reaction doesn't exist. It doesn't occur at actually occur at, like, a rapid or I forget. I don't think it's, like, thermodynamically favorable, but unless it has some sort of catalyst, right?
Mhm.
And similarly, right, like, you can favor both reactants or products if you heat up a reaction or you cool it down or whatever, right? I mean, all I'm saying there is that you can change it. Like, if you are aware of it and what you're trying to do, like, you can influence it somehow. And I
Yeah.
think it's totally fine to think about CO2 and carbonic anhydrase. It's a commendable enzyme right there. I remember this is when I first started vet school, we did these like ables, like, like
Oh, yeah,
for a week you
application-based
all get
learning
together.
experience, right?
Exactly. Exactly.
I'm so excited about these things.
Where it was like they were actually pretty cool, and I like to do it. It was for me the only way that I actually understood what the hell was going on
Oh
in the
god, yeah.
classroom. Where it's like, here's a case, but then we're also going to like stop and then talk about this mechanism and answer a bunch of questions and small group learning and all of that. But like I remember one of them, it was the equine medicine. It was Dr. McCormick, and she asked the question. She's like, "Is CO2 an acid or a base?" And I'm like, I
Mm.
granted I just was finished my master's program in chemistry, and I was like, neither. she's like, she's like, it's like no, it's an acid, and I'm like, no, it's not.
Mm,
And I and I like I don't
yeah.
mean to be difficult, but so like I got up and I like wrote out the reaction and I'm like, look, you see here like CO2 is as much of an acid and a base as is water in this case. And I was
Yeah,
like you
yeah.
have to form the acid. That's an acid, but you have to make it carbonic acid first. But anyway, I just- so that equation is near and dear to my heart. Is all I'm saying.
Oh, very nice. That's why you brought up the chemistry aspect of everything. I was wondering, that just seems like such a weird thing for a veterinarian.
But I loved it, right? It was one of those things like and this is another like lesson that I learned about life is that I took chemistry in high school, I took AP chemistry in high school, I took chemistry in college, and I hated it. Every little bit of it. And
Mm,
I didn't do orgo in undergrad. And it wasn't until because I'm like, you know what, forget all of this. And then I ended up doing like neuropsych as my undergrad major. But then, years later, I'm like, I guess I'll go to med school. But I was missing prereqs. So I went to like a post-bac program. And it was in that post-bac program when they were teaching chemistry. So it was like the fourth time that I'd taken it. They were like, it finally clicked. I was like, oh my God, I think I love this. And then I took organic and I took organic as a condensed summer program. So it was like all 3 semesters in 9 weeks. Each semester was 3 weeks. And
oh
I'm like, I
god.
cannot get behind. Yeah. It was like, if I get behind, I'm never gonna survive this, and so I was at office hours all the time asking questions, and so having these very smart people explain to me the mechanisms, because it's all mechanism, right? Electron
Hmm.
donors and, nuclear and Lewis acids and all that kinda stuff, um, and once I understood that, it was just like, it a revelation, and I fell in love with it. And so then I applied to I'm like, "Well, maybe I'll do a master's program." And Melissa, I mean, to her credit, she was like, "Just go and talk to them." I'm like, "Ah, no one's gonna accept me." It's like, "Just go into the building and ask the graduate director if you can be in the program." And I did, and they're like, "Yeah, sure, why not?"
Easiest application
So
ever. Gosh, if vet school was
yeah.
that way, we'd be really screwed.
I know, right? But I just like it's one of those things where it's like I hated it so many times for so
Mm.
long, this chemistry thing. I was more like a physics guy. But then one day I just loved it and I still do. And that's what I really like about, when we're talking about the mechanisms and all of that, the physiology, like the pathophysiology is basically chemistry and biochemistry.
It is. Oh,
So,
for sure. It really is. Yeah. I see that now. Yeah, good old chemistry. I got a
yeah.
chem minor and it was fun. I took organic in college and it was less than appealing to me. We had to learn about Krebs cycle. It
Yeah.
was Krebs cycle in vet school. It was just like trauma
Right.
all inside. I'm just like, oh no, not again.
Yeah. But it is amazing how many times you can go through something and hate it and then all of a sudden love it. So
Yeah.
it's like life is never what you think it is.
No,
Hmm.
it really isn't.
I don't know. What's your favorite thing about right now? Like what you're doing right now in this point in your life at this
Oh.
moment?
um, I think making impressions on veterinarians that haven't experienced specialty medicine, I think is kind
Mm,
of the fun side. So whether that's our ER team that I get to work with, we've only got out of 12 doctors, we got three that have had specialty experience, or to the referring community. And when I get on the phone with one of the referring vets and they're just like, what can I do for this post arrest cat that I can't get to wake up? And I'm just like, all right, let's see. What do you have in the hospital? Like, do you have, and we're talking about like a brain injury in a way. It's like, do you have hypertonic saline? They're just like, no. Like, do you have mannitol? They're like, no. And I was like, all right, now what kind of jacked up stuff can I come up with to be able to get this cat through this? And I like we come up with something, and they're just like, "Oh, that's really fascinating. Will that really work?" And I'm just like, "I have no idea. We
no.
are we are in made up medicine land." But having that interaction with some of the general practitioners, and you know, getting that different perspective, because all of my experience comes from specialty medicine. Before vet school comes from specialty and a little bit of research. During vet school, during residency, post, I've spent very little time in a general practice setting. Um, but being able to teach them how to do things that we do and have them understand it and have them see it is just incredible. The McQuitties, they reach out to me on help for cases that they can manage in their hospital. They can now manage a DKA in their
Mm,
hospital because I helped them manage a dog for almost a week. They'd send it to the ER at nighttime. They'd come
mm.
back to them during the daytime. We'd touch base about the electrolytes and what to supplement. And they got through that. That owner still knows exactly who I am. I've never met the owner, but talks with Laura about the dog all the time and talks about me. Um,
Yeah.
and now their hospital can manage a DKA, and they manage it better than the ER in the area. And so that's just
Right.
fascinating to
Yeah.
me to be able to elevate other people's medicine or change how they do medicine such that their patients are getting different care and better care is just it's fun to watch and fun to see and be a part of. I think is the big thing.
Yeah. That's awesome. That was always yeah, and that's the great thing about teaching in general is I feel like you get to I mean, it's empowering, right? I mean, it's the I always thought as I was growing up, I'm like, I have no idea what I want to do, but if I can help other people achieve the thing that they want to do, then I feel pretty good about that.
Yeah.
Because you're right, it's really nice. It's really nice to see people sort of grow in that way and then be able to do things that they never could do before.
Mm-hmm.
Now that's like a whole new person that's out there walking around that you
A
helped
whole new
forge.
world.
Yeah.
Like Aladdin.
Right. Exactly. Arguably the
Yeah.
best Disney movie.
Yeah, and the thing that I think is tough for me, tough for our team to be able to get into that right kind of headspace is not judging them with what they can't do, but recognizing what
Mm,
they have available to them and saying, "This is what we have. Let's see what we can do to work with this." You know,
mhm.
why didn't they run a lactate on this animal, or why didn't they get a blood pressure? Well, maybe they don't have a way to get a blood pressure besides a
Right.
crappy oscillometric machine. You know,
Right.
maybe they don't have this product and they don't recognize it, or maybe they didn't change up this plan because they don't know any different, because they have never experienced anything different. And once we get out of
Yeah.
the judgmental mindset, we can get into, let's help them, and see what they do have and what they can do. It's, it really is mind-boggling to be able to help them through that. And so
Yeah.
it's like teaching a student all over again and having that opportunity.
Right. It's akin to like when I was teaching MCAT prep, it was a lot of like the way that I approached it was like if somebody says something, like always find the thing that is right about the thing that they said and try to focus on that. Like even if they're like 90% wrong, there's still like 10% of what they did that they said was correct. So let's like start there and maybe not treat them like a jerk for having like the rest of it wrong. As
Yeah.
opposed to like, no. And then they never raise their hand again. They never, they don't want
Yeah.
to interact with you anymore and they don't learn anything. Yeah,
Mm.
similarly, it's like, well, what did this person do correctly, right? I mean, like, if nothing else, they're on the phone with you. Like, it's like a
Yeah.
big start. And you're right. Don't judge them for the things that they may not have the ability to do yet, right?
Yep.
Everyone is a round character in their own story if they want to be.
Yeah.
I'm gonna write that
It's
down. Everyone is a round. I'm writing that down.
next piece of advice to give someone when they're in an obscure place and they have no idea what I'm talking about. Everyone is a round character. And they're going,
In
round
their own
what?
story.
I'm going to use that next time someone gives me a confused look. I'm just going to start spouting off random stuff like that and see how they
That's a good
respond.
idea. Favorably, in my experience.
It'll be
Yeah.
perfect.
Yeah, it's okay. You're only in the second act. We still, it's like you're still dealing with the inciting incident. You've yet the opportunity to become the round character in your own story. Like walk away. Uh, well, awesome. Thanks for talking to me, man. Thank you for taking the time for
Yeah,
out of your Wednesday to talk to me, man.
this is awesome. Had a blast. I really enjoyed it. It's good to catch up with you and talk a little bit about where we're both
Yeah.
at. So
Yeah.
thank you.
Yeah. Yeah. No, absolutely. Same.
All right, man.
Bye. And that was this episode of the Greatest Profession podcast. Mike Nystrom, thank you so much for coming along and doing this with me. It's it's so nice to talk to people who are again smarter than me, but so approachable with that. We talk about this in the podcast a little bit. I love the perspective of, hey, you know what? Just because you don't know something, that doesn't mean that you are less of a human being than I am. Like we can meet as peers on so many levels. It's just this happens to be, this thing about knowledge difference. Just happens to be one of the areas where maybe you know more than I do. But you know what? I bet I know more about, I don't know, guitars than you do. Perhaps. Probably not. Probably not. I always love learning things about people that don't make any sense, like that he fixes up cars. What? Where did that come from? It's like, I mean, you know, veterinarians, there's some veterinarians where you're like, oh yeah, I could definitely see, this person just up to their elbows in grease. under the hood of a car, ripping out hoses and just, oil spraying everywhere, whatever. Um, like surgeons. But I just wouldn't necessarily think about critical care specialists and dweeby fellas such as Nystrom and myself being as somebody who would like be under a hood souping up anything. Like turbo is not really in my vernacular. But I love that it is his. It's so fun. That's one of the greatest things about this podcast for me is that I get to learn all these bizarre things, and truly get down to the person behind the medicine, which I guess was the whole point in the first place. I love what he was talking about, even when he was applying for residencies, right? Where he's like, "This is my life. I get to live it how I want to." That's fantastic. It's like it's really hard for anyone to get there, but especially if you've been kind of going down this road towards specialty, I feel like it's really difficult to recalibrate. So I had a lot of fun. Again, thank you, Michael Nystrom, or Mike Nystrom, or Mickey Nystrom. Probably not. Probably not Mickey. um, Old Mickey Nystrom. But anyway, so thank you again, and thank you guys for tuning in. I really appreciate it. Just anytime that you guys download these things, and I always hear this feedback from people about how it's going. It's like, oh yeah, hey, look at that. People are listening. So I really appreciate that. If you haven't already, I would love it if you were to share this to whomever, trap some people in your car, like, hey, let's go get some Chick-fil-A. And you like lock the doors and you put on the podcast. And that's great. I mean, I appreciate for those of you who have already done that. Thank you. We don't have the legal representation that you guys require, but we do thank you nonetheless. And for those of you who haven't, it's just, just spitballing ideas here. So anything you can do to kind of spread the word, I greatly appreciate it. And that's about it. So thank you again. If you have any questions or whatever, just head on over to my website, thegreatestprofession.com. And, there's going to be a little contact link there. So just you shoot me a line or anything you want. All right. Have a wonderful evening. And with that, may all of your flowers not die because you forgot to water them. Yeah, I mean, maybe that is a little bit from my own life. Whoops. but I wish unto you the memory capacity and the wherewithal to water your flowers. All right. Thanks again, guys. Bye.